So back to the medical school. Jack Hildes was a professor in physiology, and I, of course, thought he was God as well, or at least someone I really admired. So, and he was a very close colleague of the head of the Department of Physiology, Joseph Doupe, and I was a research student in a summer research program that they had for undergraduate students. So I became quite close to Jack, and indirectly, along with other students, to Joseph Doupe, who was became the kind of intellectual scratching post in the pasture there. He was the one that changed our minds, or he and what he set up in the way physiology was taught. By changed our minds, I meant he changed the way we think. He did two things. First of all, he created a forum where everybody was treated as equals. There was no intellectual hierarchy. So that every professor in the department attended every lecture to medical students. And he would ask questions not over the students, but over the faculty. And then he'd say to a student, "Do you believe what he just said? Do you think he has any reason to say that?" And suddenly you came to realize that there was no hierarchy, and that what you thought mattered. And so suddenly you changed your sense of what you were. You were no longer just one of a bunch of students. You had an independent and view of the world, and that was his great gift, to create an environment in which people allowed themselves to be intellectually independent.
He seems to be a legend.
He was legendary, and both in his he was a unique personality, very shy, very awkward, didn't speak fluently, and so on. But he essentially understood that what was really important was to awaken the students intellectually, rather than have them go through laboratory exercises by rote, and that you could awaken them by getting them to involved in doing some kind of research. It's a tiny little project, but how do you establish something to be true in medicine? How do you read what someone else has done and decide whether it adds significantly to the body of knowledge? All of those were things we started to think about as first-year students. And then, of course, through his special program, the summer research program, which led to a Bachelor of Science in Medicine, became a vehicle. And we used to have these afternoon seminars in the steamy boardroom in the physiology department, sort of falling apart. And it was, dead of summer, with the prairie summer with 100 degrees in the 20 degrees in the room. And we would have to do literature reviews and present it and argue for them and so on and so forth. And there would be, the professors would be there would be arguments going back and forth, and every once in a while Joe Doupe would lob a question in like a grenade, which always blew the conversation apart. So it was hard not to get inspired by it. And he had this great talent for helping people to start asking questions rather than looking at the answers. And I remember Charlie Hollenberg telling me a story that when he went to see Joe Doupe about a topic for his research, undergraduate research, Joe said, this is an article that indicates that fat tissue is innervated. I want you to do a project to find out why. And that was all. But that was the issue. Well, the question, what is the question? Why is it like that? Clearly, if it's just a passive store of fat that just sits there, the fact that it's innervated means that there is something active going on. It's under neurological control. It's part of some kind of regulatory. Those were all the questions or ideas that were implicit in that question. And that's what he had, was that knack of getting you to think about important questions.
So he's a kind of Socrates of the medical school.
And he was quite Socratic in his lectures as well. You know, he'd pose questions, excuse me, to the class and to individuals. He had this little game he played. He had two top hats. One was Kelly green. Obviously, someone wore it for Easter, or and then there was a black hat, both top hats. And he had the names of the students on small chits. The left chit, they'd say Naimark. Tell me about so-and-so. Why do you think X is the case? And depending on the answer and the discussion followed it, my name went either into the green hat or more often than not into the black hat. And in the end, at the end of the course, the black hat, all the people in the black hat had to buy beer for all of the people whose names were in the green hat. But there was that sort of milieu that was established, and he thought very deeply about medical education as a whole, in which he, and research for him was how do I get people to understand that the human intellect is subject to error? And therefore, when you are looking at things, you should always be saying, what are the possible sources of error and how do I control for them and so on? How do I get across that people should not abandon their own thoughts because of someone of higher standing speaks ex cathedra about things? And so that was very deep in his concern for this medical education.